Welcome, everyone. I am really excited for today's conversation. I'm joined here in the studio by Everett Steele, Senior Vice President of Operations at ChartRequest. Everett's path to healthcare IT is fascinating. He is a U.S. Army combat veteran who served as a platoon leader and operations officer, later became chief of staff at the city of Atlanta, and now leading the charge to solve one of healthcare's most persistent challenges, getting medical records to move seamlessly between systems. ChartRequest now connects over 78,000 healthcare organizations through its interoperability platform, and they're at the forefront of implemented TEFCA, the nationwide framework for health information exchange. Everett has built a pretty unconventional path into healthcare, from combat operations to city government, and now leading operations in healthcare tech and solving problems in interoperability at scale. Would like to ask you, Everett, when did the vision for ChartQuest, uh, Everett, so what made you start ChartRequest, and tell us a little bit about your starting story.
Sure, absolutely. Thank you. It's a pleasure to be here. Great to connect with you again. When I first heard of what Chris Carter and the ChartRequest, kind of founding team were building, it was very exciting to me. As you noted, my career has kind of gone from private sector to government work and back again. Where I've really always found my stride and where I've really been most comfortable is identifying big problems and leveraging technology and operational excellence to address and solve them. And so, healthcare, as you are well aware, and as everyone listening to this knows, has a lot of big problems. Right? It's a big, messy problem set, ranging from, as you mentioned, uh, you know, tens or hundreds of thousands of facilities and providers and practices around the country, connecting them end to end for data, things like that. But also, there are many other components and players, from government agencies to non-governmental organizations, auditors, private healthcare companies, et cetera, et cetera. And so, when I first kind of learned of what the ChartRequest kind of vision was, it was very, very exciting, inspiring to me, because it was literally a huge, huge problem that didn't have an answer. And I saw ChartRequest as being an answer to the problem, and got involved about, over 2 years ago now. And in that time, we've grown the company from, I think, 40 or 50 people to, I believe, we're about 175 as of today. And we are significantly increasing revenue over year, customer base year over year. You mentioned 78,000, and I think we're over 100,000 right now. We are growing at that rapid of a pace by embracing technology, leveraging AI, and just building really great people operations. So to me, it's a very, very exciting problem to solve, because it has scale, it has scope, and it has impact on human lives. At the end of the day, every single one of our patients, or our requesters, is in some way impacting a patient's life and their quality of care. And in doing that, we're changing lives. And I think, what can be more appealing and meaningful in your day-to-day life than doing that?
That is exciting and absolutely commendable. So, thank you for sharing that. On your site, in your recent articles, you've written extensively about TEFCA, the Trusted Exchange Framework
Mhm.
and Common Agreement. For those who may not be that deep in healthcare IT, can you walk us through what TEFCA actually enables, and more importantly, how ChartRequest has positioned itself within the nationwide interoperability framework? And what's been the strategic unlock there?
Sure. So TEFCA is a federal program, basically a federal set of standards to make the share and exchange of data seamless by standardizing the inputs, the outputs, the security layer, et cetera, et cetera. It's one of those kind of classic technology solutions in a way, right? There are 6 million different standards, and everyone knows it's not the ideal way to do it. So we invent a new standard, and now there's 6 million in one. But the idea is that TEFCA will allow federal oversight and federal control and inputs on what makes sense, right? So that we don't have just the wild, wild west of data exchange. As I mentioned earlier, there are so many people in the overall sort of data marketplace space, right? There are providers who are creating lots of data, but who also have an appetite for data, as they are, patient referrals and, transfers and things like that, growing clinics, changing clinics, providers moving from one clinic to another. You have the whole world of audits. That can be, Medicare, Medicaid. That can be
Mhm.
payers, healthcare payers, insurance companies, third parties. And then you have a whole nother world, which is the legal requester community. So, God forbid you're in a car accident and your attorney is trying to make sure you are made whole by whomever was guilty, whomever was, involved in that. They are reaching out to EMS service providers, ambulances, imaging, treatment, your ongoing, PT or OT, et cetera. And so, standardizing that in such a way that there are common, known, documented, regulated endpoints is critical. And so where ChartRequest plugs into that is we want to be the hub that sits in the middle, right? That takes all these myriad standards, all these different electronic healthcare record systems, all these different imaging systems and billing systems and whatever, and ties them all together into a place where the people who need them, which ultimately, and I always try and center us in this, ultimately is patients, right? And
Hmm.
how do we get it into place where it provides the absolute best experience for everyone involved, but really centering it on the patient? At the end of the day, if you are in a position where you need your medical records moved from point A to point B, it is very likely you're not having a great time. You're typically not doing this for a great reason in your life. And so building, a team and a support base and an easy to use platform as we have done, we've always kept that in mind, right? Like centering the patient in what we do, because at the end of the day, it's a real problem and it's a real challenge. And as you, I'm sure, in your personal life, and I have many times navigated the world of health records and insurance and everything else, it's not a ton of fun, right? And so we are very proud of kind of the work we do in making it as simple as possible. And with the advancement of new tools, new connection endpoints, new AI automations, I think we will continue to innovate and increase the patient satisfaction, provider satisfaction, and just quality of life for everyone touching health records.
Absolutely. With that being said, you've built a network of, as you said, over 100,000 plus healthcare organizations through care quality integration. That's a massive scale. What's been the most surprising about operating at that level of connectivity, either from a technical standpoint or in terms of how providers actually use the system once they've connected?
That's a great question. It's really thoughtful. I think probably two things. One, just managing data at this scale is a challenge, right? Because not only do we have internal, service level agreements (SLAs) to meet for our clients, we also have just internal best practices that we hold ourselves to. But we also have external standards, right? Every state, for the most part, has different requirements on how long data must be managed, how people can access the data, the fees, and other sort of things that you can do while handling those data, while releasing them to people. And so, staying 50 state compliant and managing all this data in a way that protects our patients, protects their records is absolutely critical. And so we've built a pretty great team who kind of specializes in this kind of work. And then built upon that, the other nice thing is what a huge resource, right?
Mhm.
By having this data and being able to de-identify the data, we can use it to make predictive analytic decisions around where our customers are going, where our clients are moving, insights to providers as to kind of the health of their client base. One of the things we're working on right now that I'm super excited with is a reporting dashboard for our direct access clients, where they can actually kind of get a read on the health of their organization based on the changing volume and the shifting kind of landscape of their inbound and outbound medical requests, right? Sounds a little
Right.
boring, sounds a little complicated, and it is probably to most people both those things. But at ChartRequest, we are so passionate about it, and it's so fascinating to us that having a mass, I mean, terabytes and terabytes of data on hand is
Mm.
it's an amazing resource, right? There's tons of value in that, and so we are continuing to strive and innovate and really direct our teams to think. I hate the term "think outside the box," but it's really what we need to do, right? To figure out how to best connect the people that have the records with the people that need them, and do it in innovative ways that provides real value to, again, the requesters, but also the patients themselves.
Absolutely. Talk to me a little bit, because I have a background in EHR and EMRs specifically. Are there any integrations with EMRs as well?
Yeah, absolutely. We are direct integrated with probably going on a dozen or so right now. So you mentioned the
Mhm.
Care Quality Network, and I won't name the names because who knows.
Mhm.
But yeah, we have a number of direct integrations that allow us, both in an automated and a manual process, to find, retrieve, and most importantly, QA the records that we find, as well as to release on the behalf of our custodian clients. And so it's an ever changing landscape. There are a number of standards. You mentioned TEFCA, the Fire API standards. There are so many different ways of exposing these data points to those who need it. And we will always continue to add new ones. I just had a meeting this morning, and we've got about a half dozen more integrations on the roadmap that are in some state of being built, being launched, et cetera. And so it's an exciting time. I mean, our network is only growing. And to your last question, that means the data is only growing. That means the opportunities we can use AI and other systems to continue to innovate is really, really an exciting time. If you can't tell, I am very excited about ChartRequest and what we're doing right now. And these last 2 years has just been an amazing experience. And I know we're going to be continuing to grow well beyond, where we were 2 years ago in the next couple of years.
Absolutely. Something that really stood out to me, Everett, was CROWS, so Chart Request Operating System. This isn't just a tech stack, it's your internal framework and how the team operates and adapted from EOS. When did you realize you needed to formalize that? And what's been your most effective about implementing across marketing, sales, products, and operations?
Sure. So the chart request I can't speak. The chart request operating system, CROS, is the backbone of what we do. It informs everything from little things. I just had a meeting this morning about a hiccup we had with receiving inbound mail, right? And there's a process for that and the communication of it. But years ago when I started here, myself and CEO Chris Carter sat down, and we've been at a myriad of different companies, from private to venture backed to public to government, and we've seen it done a million different ways, right? And we realized to really get everyone kind of rowing and pulling in the same direction, we needed to formalize it, we needed to standardize it, and we need to communicate it out in a way that was crystal clear. So when you start at your first day at ChartRequest, you have access to a wealth and breadth of information about how we've been operating, to include historical scorecards over the last several years of operations, presentations, training manuals, and a suite of, gosh, hundreds, if not thousands of pages of technical documentation, SOPs, and just frameworks for existing. And it's one of those things where I think a lot of companies, you know, have an idea of how they do things. And there's probably a 3-ring binder on a shelf somewhere that kind of lays it out, and people are showing start. But we live it every day. I mean, we got a meeting coming up on Thursday, an all hands meeting. There'll be 170, some 180 people on the call. We will speak to the metrics. We will speak to the operational cadence. We will make sure everyone is aligned, because in this modern world of remote workforce, I mean, we are 95% remote, right? Outside of our kind of core contingency in the corporate office here in Atlanta. And, you lose a lot. There's a lot to be gained by being remote, but there's also some loss, right? Like you miss those
Mhm.
water cooler conversations. You miss overhearing something in the hallway and it kind of piquing your interest. And so we make a very concerted, very deliberate effort to not just communicate, but probably over communicate and confirm, with all new employees, with everyone periodically, that like they understand where we're going, they understand the systems by which we're doing it, and I think most importantly, this is an iterative system, right? Again, this is not a 3-ring binder that someone made and shoved on a shelf and never got looked at again. This is a living, breathing document that we talk about, that we publish articles about, we write thought leadership pieces about, and we make sure that everyone in the company really understands and buys into the idea of why we're doing this, why it's so important, and how they can be a part of changing it and iterating and constantly making it better.
Wow. Wow, that's very interesting. Given my background in Epic security and EMR consulting, I'm curious about your perspective on the current state of EMR integration. You're connecting to systems across Epic, Cerner, Meditech, and dozens of other platforms. What are the biggest friction points you're still seeing when it comes to secure, compliant record exchange? And when do you think the industry needs to evolve from a security and access control standpoint?
Gosh, yeah, that's a great question. I think one of the most surprising things, or maybe the most impactful things, is, you named the big ones just now, right? And that is a lion's share, a plurality of the market for sure. But for every one of those you named, there are dozens, if not more, one-offs, right? Things that have been, I mean, we deal with, in the entire range of our clients, we deal with folks who are on the big ones, all the way down to folks who are just purely on paper records in a filing cabinet in their office, to things in between, right? Like on-prem hosted solutions that the company could have gone out of business a decade ago, but the system's still running and they're still using it. And how the heck do you get data into and out of those systems? And so, it's interesting. I go to a lot of conferences. I talk to a lot of people about this. And one of the things you always hear is, AI is the future. AI is going to take care of all this. All this is going to be AI. And I fully believe that up to a point, right? I think where that falls apart is at the end of the day, AI can't go into the basement of a hospital and find paper records with a flashlight in a dusty old basement and get them into the system. We are a technology enabled company. We are a technology powered company. We believe in the power of tech to change the world and change healthcare in America. But at the same time, we're a people organization, right? I mean, compared to the kind of overall landscape of our clients, I'd say we're pretty well staffed, probably per capita compared to some of our competitors, solely because people make the difference, right? If you go on Google right now and type in ChartRequest, I want to say we have 1,400 5-star reviews from patients and providers. I don't think our closest competitor has a dozen total reviews, much less that scale, right? Because we have a amazing support team that is answering the phones 24 hours a day, that is helping get people, their records, helping facilitate the financial aspect of it, holding their hands in some difficult times, like I said, in their lives. And ultimately, there will always be a new contender for the best EHR in the world, right? There's always going to be a new person entering the thing. There's always going to be industry consolidation and realignment. But again, we center ourselves on patients. We center ourselves on process and leveraging and utilizing technology that emerges to best, meet our goals. But I think we will always see new standards. We'll always see new communications protocols, methodologies of sharing data. And at the end of the day, the companies that will succeed, will continue to grow and succeed, are the ones that keep their finger on the pulse of the industry, that listen to patients and providers and healthcare payers and everybody else, and that are able to be agile enough to respond to, emerging technologies like AI, like large language modeling, et cetera, et cetera. So that's what we're trying to do. And it's a challenging task to take on. But I think we're doing a pretty good job of it. I think the proof is in the reviews, as I say.
Wow. I mean, just kind of listening to you talk just about the innovation and all the things that you guys are doing from a, technology standpoint, it's amazing. But I couldn't help but go back 30 years in my head as you were speaking, because my first opportunity was that in the health record space.
Okay.
So I worked in the medical record space. So, in terms of like the big basement file room and, having to go down and look at a numeric system and go and find a specific chart based on a request that came in because somebody wanted to pull their medical records, all the papers that are in there. So, though I've spent, a greater part of my life in the EMR space, my beginnings, came from the health record space. So I totally understand from that standpoint of chart requests and medical records. But I want to get back into the conversation and tell you a little bit about you've written about the Rising Stars program, a structured internal development track to grow future leaders within an organization. That's pretty intentional for tech company. You mentioned in one of those articles as a former Army officer that you learned the most important job of a leader is to ensure the next generation can fit the boots. How does that military leadership philosophy translate into how you're building the chart request team?
Sure. No, that's a great question. And one of the things that you learn as an Army officer, or probably any leader in the military in the United States or probably beyond, is a saying that I use a lot, which is mission first, people always. And what that
Mm,
means really is that we will always remain as an organization critically and singularly focused on the objective that we need to accomplish. But you can't do that without people, and people have to always be a focus, right? And so things like the Rising Stars program, we identify either through leader recommendations or self-selection, which I actually like the most, people who say, hey, I like what we're doing at ChartRequest. I like what my job is, but I want to do more. I want to take on more leadership, more responsibility, ideally more compensation. That's always a part of the conversation. And we build very crafted programs. Usually they're 90 to 180 days. And when I say we build it, I mean the Rising Star. And that is a key point of the program, right? If I come to you or anyone in our team and say, hey, I want you to become a senior manager of whatever, and I write out a plan for you, and it's exactly what I think you should be doing, and you do it, you have no buy-in. You don't feel like a stakeholder. You feel like someone who's been given an assignment. This works the opposite. Our team members come to us and say, hey, I want to become this role. I see a gap in the organization. I see a gap in my personal skills. I see an opportunity for growth, and I want to do it. And I say, that's amazing. Put together a plan. Show me what that looks like over 6 months. Show me what that looks like over the next 9 months. And they come back and we say, hey, look, here's milestones, right? In the first 3 months, you're going to get, this certification that proves that you are, invested in this program, and we'll pay for the certification. We'll support you through the training. The next phase, the walk phase, you're going to lead a team, right? We're going to give you a team of 3 or 4 folks, individual contributors, and roll them up under this new initiative. And then we're going to let you run with it, right? We want you to come up with the metrics of success. What are the KPIs that drive your new little division or department or team or whatever? And we hold you accountable for it. And so we talk a lot about metrics and KPIs, and I know every company does, right? But we really are driven by it. And so the Rising Star program that is baked in, right? It is, here are the KPIs you own. They impact your total compensation package. They impact the report you give every single week on how your team and your department is functioning. And we keep ourselves accountable and aligned to those folks. Like I said, the most important part of being a leader is building the next generation of leaders. And if you're not doing that, you're stagnating. You're not growing as a company. You're not growing as a leader, and you're not growing, sort of the future of the industry and the organization. And so, it's one of the things I think is kind of what we consider a values-based corporation. It's accountability to ourselves and accountability to each other. We've got some, and I would love to just name names and tell you all the great people who've gone through this program. I won't do that, but we've got some great success stories. I mean, people who came to us a couple of years ago as individual contributors who are now scratching on the door of the executive team, right? People who I believe will be on the executive team in the next couple of years, all the way from coming to us in their, early 30s, late 20s, and just maturing them and getting them through this process. It's a great thing to see. And it's so much easier to take great people and help them become greater than it is to take a roll of the dice, someone off the street, and think, do we just thrust this person into a senior leadership role? No, let's build them in-house. And it's really powerful. And it's just, we have seen such returns on this program over the last couple of years that it's, something we're
That is amazing. That is amazing, and that shows a lot of promise and also consistency and growth that you're building from the inside, and that is, a company that people wanna be aligned with. So I commend you for that. The 21st century, Cures Act and information blocking rules have put real pressure on healthcare organizations to share data more freely. How are you seeing that regulatory shift change behavior on the provider side? And what role is ChartRequest playing in helping organizations navigate compliance while still protecting patients' privacy?
Sure. Yeah. So, I mean, obviously that, is a foundational piece of legislation in our industry. And, we deal a lot with attorneys and with healthcare providers, right? And this is two populations of people who went to school and are very, very smart people and learned a whole heck of a lot about their fields of law, their fields of medicine, but they're not all, on the other side of the coin, right? Like healthcare providers
Yep.
don't know a whole lot about the law typically, right? And they, have a tough time staying abreast of the latest regulations, et cetera, staying current. And so, what we really try and do is a couple of things. One, we ensure that our systems are so far ahead of the curve in terms of what the law requires that we don't have any, compliance issues. At the same time, we really try to communicate and educate and train our custodians, our healthcare providers in what the law is and how it impacts them, because we want them to be compliant, right? It is very challenging, right? We talk to folks at conferences, we have inbound, sales calls, talk to you all the time, and they will ask them, how many records does your office process a month? Most of the time they will give an answer that they feel like is right. And as we kind of do more discovery, realize they were sometimes an order of magnitude off, right? And it's because they don't know. If they knew, if people come to me and say, hey, we do 350 requests a month and 87% of them are non-billable and, 23% are billable and it's from these specialties and these requesters, I'm going to say, you don't need us. You've got this thing tight. You've got a system and you've got a practice. But most people don't, right? Because that's not what healthcare providers do. They are not in this world of managing records to this degree. And so, by ensuring that we stay compliant, we advise our clients on
Yeah.
compliance issues, and we just maintain an unbelievable turnaround time. We have a 5-day turnaround guarantee for release of information, and that's better than anybody in the industry. Right now, we're at 2 days, I think, turnaround on average, which, talk about staying compliant, you got 30 days to release the records in most cases. 2.2 days really make sure you have a good margin of
Wow.
breathing room in there. And it's so funny because we tell people that, I go to conferences, do whatever, and I'll tell people, yeah, our turnaround time right now, on non-audit stuff is 2.2 days. People will say they don't believe me. So we have a dashboard I pull up. I say, look, here it is right now. Here's what's happening, right? And so just by being a good partner, by being a good, managing good relationships with our clients, which is so important. We become a trusted, valued resource that ensures that they are staying compliant, they're not running into these issues, and they focus on the thing that is so important and so critical for all healthcare providers, the outcome of the patient, right? Patient care, outcomes. Focus on that. Let ChartRequest be the data nerds who focus on the turnaround times, the Cures Act, all the other things like that. And you guys care about
Mhm.
patients. And I think that's why our partnerships work so well. And we have so many people that have been with us for so long now.
Wow, that's great. Kind of moving forward on the vision, looking ahead over the next 12 to 24 months, what are the key signal metrics you're most focused on to know Chart Request is moving in the right direction? What does success look like beyond just adding more organizations to your network?
That's great. So a couple things. I think one, I am not exaggerating when I say I look at our patient Google reviews every single day, literally every single day. And is the North Star metric for me and sort of a heuristic evaluative, framework. That is huge. Moving more to the quantitative side of things, we want to constantly be innovating and iterating, right? I want to continue growing our client base while I think maintaining a headcount kind of where we are right now. And so to do that, we're leveraging AI enablement tools. They're going to allow us to kind of automate some of the processes that we currently do more manually. So ensuring that we're always driving towards that as a goal. We set out, at the end of every year and kind of lay out the strategic plan for the upcoming year, right? And so our 2026 strategic plan is well underway. And so that includes lots more integrations, lots more, expansion of our sort of operations, bringing more AI into the processes. And then, ultimately, I think ensuring that as we grow, we always maintain value and quality for our customers, right? It's very easy to grow and get out kind of, in front of yourself a little bit and quality declines, the satisfaction. So we're actually building right now as part of our 2026 plan, a number of big data, like dashboards and tools to really give us a better understanding of our clients continuing to really appreciate our service? Is it meeting them where they are? Do we see possible friction points emerging as we add new, services, as we add new features? Where are we possibly breaking the platform in a way that's not ideal for our clients? We are super fortunate at ChartRequest in that a large number of our clients use our software in their offices and their practices, wherever, but also a large number are actually powered by our people who are doing the process on their behalf. So we have this amazing resource of dozens and dozens of people who use our platform in and out every day who work for us. So using them to understand like their overall satisfaction in the platform, what little hacks are they using to kind of make things go faster, and how do we operationalize those and build those into the product plan?
Mhm.
It's an amazing resource. And so, when I think about, what does success look for at the end of 2026, obviously we have, revenue goals and we have, things like that. But really to me, what success looks like is, are the people that we're serving happy and well served and satisfied with what we do? Are the people that we work alongside, are they feeling valued? Are they feeling respected? Are they feeling like they're in a place where they can continue to grow and advance their career? And, ultimately, is the service we provide of value to everyone who touches it? And I think if we can say those things at the December of every single year going forward, I think the rest kind of falls into place pretty organically.
Absolutely. Absolutely. That's definitely what success looks like, I believe. Everett, it has been an incredible value. You've been solving problems that every single person working in healthcare IT feels on a daily basis. And it's clear that you're thinking deeply about both the technical and human systems required to make this work at scale. I really appreciate your time and openness today. And I just want to further reiterate how much I appreciate just you taking the time. Okay.
Awesome. Well, thank you again so much. It was a pleasure chatting with you, and hope to continue the conversation. But yeah, I think ultimately you hit the nail on the head, right? Our goal at ChartRequest is to drive patient experience, provider experience in a way that provides a valuable, meaningful service that touches lives and drives patient outcomes better and better year over year. And so I appreciate you asking some very thoughtful questions, and hopefully I shared some valuable insights from our perspective that will help other folks. And so if you are in need of release of information or retrieval services, I would encourage you guys to reach out to ChartRequest. We're a delight to work with. I'll say that.
Absolutely. Thanks again.